Welcome back.
Governor, just a question for clarification, because it seems like no one seems to know where this memo,
Good to see you, Chairman.
where this directive came from. You're saying that you're not sure who wrote it. How Ghost didn't write it, right? I mean, how do you not figure out who wrote this directive that is in the middle of such controversy?
Yeah, I don't think that's what the controversy is about, really. Look, we have two very different opinions on what happened during COVID. I think the federal government failed this nation, and it was abysmal. How did COVID get to the United States in December and nobody knew? How did it take so many months before we had testing, basic testing in place? How did you have a president of the United States running around saying it's going to be gone when the weather gets warm? By Easter, it's going to be gone. Who then admits to a reporter that he purposely downplayed it, and he likes to downplay it after he knew that millions of Americans' lives were at risk. How do you have no national policy? How do you get to a situation where you have no PPE, where you leave states on their own? I'm trying to buy masks from China, sending a plane to China to buy masks. I'm competing with other states, bidding up the price for masks and essential equipment. You know, the federal government is the federal government. I believe in states' rights. I'm a governor, but I was also a federal cabinet secretary. And we needed the federal government to actually act and not to say to 50 states, God bless you, you're on your own. Now, there are facts that have been established. 4 years ago, what the Republican administration said was, well, it's the fault of the Democratic governors, okay? 4 Democratic states were then investigated by the Department of Justice at the president's request by the president's political operatives. Those investigations went on for 4 years, cost taxpayers millions of dollars. We now have the results of those investigations. Department of Justice found we did nothing wrong. The investigations found that the New York advisory was wholly consistent with the federal guidance set by CMS and CDC. 2 investigations found exactly that what New York did was implement the federal guidance. At the same time that 12 other states implemented the federal guidance when it came out. Those are facts. It's a fact that the federal government says we're number 39 in the United States in terms of nursing home deaths pro rata. Think about that, number 39. Only 11 states have a lower pro rata rate of death in nursing homes. And in New York, we had COVID first and worst. We had the highest infection rate on the globe, but we wind up 39. Year 1 of COVID, according to the federal government, we're number 2 in deaths. The end of year number 2 of COVID, we're number 30. That is, that's the federal government's numbers. That shows that New Yorkers rose to the occasion. New Yorkers did in my opinion, a great job, should be very proud of what they did, because the results matter. The numbers matter. And what New Yorkers did saved tens of thousands of lives. So this is a hyper-political environment. I believe the federal government failed this nation. And yes, it was the executive, but by the way, the Republican Congress was right there. And when the president was doing what he was doing and saying what he was saying, I didn't see any of them stand up and say, hold it a second, the Easter Bunny is not going to solve COVID. Hold it a second, don't drink Clorox. It really is not going to help you. By the way, hydroxychloroquine, there's really no scientific basis for hydroxychloroquine. And as a matter of fact, it wound up killing 16,000 people. By the way, when the president does a 180 on vaccines, where he goes from saying, I created the vaccine, one of the greatest creations in mankind, and says people who take the vaccine don't get as sick and don't go into the hospital, which happens to be true, and then politically takes pressure from the conservatives and becomes an anti-vaxxer, I didn't see any of them stand up.
So you're saying that you don't know who wrote the directive that came out?
It came out of the Department of Health. Do I know the individual's name? No, but it came out of the State Department of Health, and 2 investigations said that it is wholly consistent with the CMS CDC guidance.
It's identical to the federal guidelines.
There were, forget me, 2 investigations, one by the New York Attorney General, one by the Assembly, said it is wholly consistent with the CMS CDC. So forget the politics. Republican Congress says this, Democratic governor says that. They asked for investigations, right? They made their allegation. We want investigations. There were now 6 investigations. Took 4 years. A lot of good people were maligned for 4 years. Well, what do the investigations say? What's the conclusion from these objective, expensive investigations? Department of Justice finds no wrongdoing after 3 Department of Justice investigations. 2 investigations say the New York advisory was consistent with the federal guidance of CMS and CDC. So, forget the politics. Republican says this, Democrat says that. What did the independent investigations say? That's why we took them. That's why we spent all that money. All right, so what did they say? And that's what they said.
Do you take any accountability, though, for that directive being in place in New York in March of 2020?
That directive followed.
But do you take accountability for it being in place?
Let me just finish. That directive followed the CMS and CDC federal guidance. That's been proven by 2 investigations. If I knew then what I know now, I would have told my Department of Health, don't listen to the federal government. They don't know what they're talking about. Because what the facts now show is, you know what happened in nursing homes? The staff walked the virus through the front door of the facility. Think about it. January, February, March, April, May, 5 months, there's no testing. Nursing home workers work during the day. Every night they go home, they see their family, they go to the restaurant, they go to the movie, they get infected. The next morning, they walked the virus right back into the nursing home. That's where it came from. That's what the studies show. Communities that had a high COVID rate had a high COVID rate in the nursing home. Communities that have a low COVID rate had a low COVID rate in the nursing home because it was coming from the workers. That's what the Harvard professor who testified said. The infected workers were bringing it in through what they call asymptomatic spread. It was not knowing. They didn't feel any symptoms. They went to work. They spread COVID. Well, how were there no tests? Why didn't you test the nursing home staff? Because there were no tests. Well, how can there be no tests for 5 months? And that's my point. Where was the federal government? How does it take 5 months in New York? Many other states, it took even longer just to develop a test. And the reason it's important, is because if this happens tomorrow and we don't learn this lesson, the same thing is going to happen again. Thank you, guys. I have to catch a plane.
Can I just ask one question here? What do you got? Regarding